So, good evening. We'll start the session. Give me 1 second. Yeah. So last week we had a session on introduction, right? So we talked about what the course is about. I hope I'm audible, right?
Yes, sir.
Can somebody? Okay. Thank you. So last week we saw the what is this course about, what we are going to learn. So today let's start with the introduction. So we'll understand the importance of acupressure, and we will also understand various medicinal systems. See, the important point here is that today for any problem, we have two set of people. Whomever I talk to, we have two set of people. So one set of people, they believe only on allopathy, whereas the other set of people, they completely they don't want to go with allopathy, so they rely on other medicinal systems like Ayurveda, Siddha, or something like that. So either extreme is not good. So we need to have some understanding about medicinal system. So today we'll start with that. Okay. So before we start, I'll just give a quick introduction about myself. So my name is Ramesh, and I'm basically a software professional. I'm not into medicine, but I'm a healer. I've been healing for the last 8 years, and I'm also an acupuncturist. So I've been treating people during COVID, and initially in my initial days, I had a lot of health issues. So I thought, I did a lot of research into many subjects, and one interesting subject was about health actually. So then I came to know about various other medicinal systems. So I had some health problems for which I never found a proper solution. But when I took certain things like homeopathy, Siddha, Ayurveda, I got very better relief. Then I started getting interest into health actually. So I became a healer, and I'm also an acupuncturist. That's a quick introduction about myself. So let's understand one important thing today about what all the different medicinal systems are there, right? So all of us know that if I ask for medicinal systems, then majority of the people will talk about only allopathy, right? So, but there are many other medicinal systems are there, and it is very important for us to understand how these medicinal systems are working, whether it is allopathy or homeopathy, Siddha, Ayurveda. There is also something like healing. I don't know how many of you know there are healings are there. Healings are like pranic healing, Reiki. Then you have many other medicinal systems are there. So we need to have some clear understanding about what these medicinal systems are, and it gives us a very important different perspective into solving our health problems. Okay, so first let's understand what is the importance of acupressure. So acupressure is basically a life skill, right? So what is a life skill? I'll just give some small story. With that we will get started. So I read this story somewhere in my earlier days, when I was a student or something. So, so one pandit, you know who is a pandit, right? So they are all very learned people. So a pandit goes to other village. From one village he goes to another village. So on another village there is a river he has to cross. So he takes a small boat. I don't know what you call in English. It's a very small boat. Parisal we call in Tamil as Parisal. So he takes that small boat, and then he hires a person who can take him from one place to the other place. So this guy, it's like probably 1 hour journey. So he doesn't know what to do. So he start talking something to that person. So he asked him first, have you, learned Ramayana, Mahabharata? Then this person says, no, I had not. Then he says, you wasted 1 year of your life. Then he starts asking so many questions like, have you read this Upanishad? Have you read this thing? Have you read that? Everything that guy says, because he's a very poor guy, right? He doesn't know anything other than boating. So he says, no. Then this guy kept on telling him like, for every question he says, you lost 3 years, you lost 5 years. Then when they cross middle of the river, then this guy asks a question. He says, do you know swimming? So this Pandit says, no, I don't know. Then he says, you lost your entire life because the boat is having a problem. No, I'm going to jump into the river. So this is a joke, but what it gives a very important aspect is whatever we learn in life, we learn them primarily for our earning purpose, right? Some of you could be a IT engineer, some of you could be teacher, you could be many people, but those are not skills, those are not life skills. So life skills are something that solves your hardcore problems. They save you from many issues. So for example, life skill is swimming. Swimming is a life skill, right? Everybody should know. So these are all life skills. So knowing about at least one medicinal system is a life skill. So now we can learn so many things, right? There are many things are there, Ayurveda, Siddha, there are many things are there. But can we learn all these things? It's very difficult. If you are really a student, yeah, fine. But if you are a working professional, you want to learn something, it is not that easy to learn. So the best way is to learn about acupressure, because acupressure gives you a lot of insights into Chinese medicine, which also gives you idea about why diseases are happening, which is the most important aspect of today's session. And more importantly, whatever you study, you cannot practice. I mean, if you cannot practice, then there is no point. It just remains as a knowledge. It is not a skill. So, if you learn acupressure, I will, through this end of this session, you will understand that you can practice on your own. Uh, now, see, the problem here is that there are many books that are available in acupressure. They say you massage this point, that point, but that doesn't give you a whole idea about how things are working, right? So that is not a complete knowledge. So the idea of this is you get a life skill. So so that's the most important thing. Now let's move on to the main agenda of today's discussion. So what is the difference between allopathy and other medicinal systems? Okay, so let me ask a question. How many of you think that you have to rely on allopathy, and how many of you think that allopathy is not good? Can somebody give me some idea?
Allopathy can be, based on supposing we have any chronic thing, like where you need surgery and all, then you can't help it. Otherwise, I feel there are other supplementary treatments, where you can rely, like homeopathy or, like as you said, acupuncture and Ayurvedic. These can also heal so many things, and basically, allopathy gives you side effects also, which definitely one would not like to go on day-to-day basis.
Correct. But one thing which I don't agree with you, that allopathy is not good for chronic issues. Allopathy is good for acute problems, not for chronic issues. This we'll see in the sessions. Yeah. So yeah, I understand. What you said is 100% correct. But yeah, allopathy definitely has certain advantages, certain disadvantages, right? So if we deny
Yes.
allopathy, then it's a grave mistake. Similarly, if we deny
Hmm.
other medicinal systems, also it's a mistake. So we need to understand, that first of all, we all need to know that there is not one medicinal system. There are many medicinal systems are there, and it is our choice to decide what we want to choose. Correct. And today's session is going to give you that kind of perspective. So let's understand, allopathy. What are the advantages? On the left hand side, whatever I given here, these are the advantages. So you have highly advanced diagnostic. It's not that other medicinal systems don't have a diagnostic. So, for example, you go to a Ayurveda or Siddha doctor or acupuncture doctor, they do diagnostic. So, how do they do diagnostic? They use pulses, right? The pulses of allopathy is not same as pulses of this thing. So, when you go to a allopathy doctor, he does a pulse reading, which is nothing but the pressure on the blood vessels. So he sees what is the pulse of that, which is not giving you a complete picture of the health problems. Whereas if you go to a Siddha or Ayurveda, they do Nadi Pariksha, whereas there it is different. For example, Ayurveda has three nadis, which are corresponding to the three doshas, like Vada, Pitta, Kapha. Siddha also has the same three, but it also has a fourth pulse, which is not disclosed typically in the internet. And if you go to acupuncture, so there are 12 pulses are there. Each pulse talks about your healthiness of your organs, one on one organ, each and every organ. And homeopathy also has a diagnostic, but that is not based on these kind of techniques. It is primarily based on the symptoms that you have. So, but nevertheless, allopathy has a highly advanced diagnostic. So, for example, if all of you are, I don't know how many of you do, but what I recommend is if somebody is of 30 years, 35 years plus, you should definitely have once in a year. What do you call that? Master health checkup. That is very important because see, you have seen, you would have heard about somewhere, that this person was, very healthy. He had no problem. Then suddenly he fell sick and then he had some chronic issue. So these kind of problems can be easily identified using, allopathy, where we have advanced diagnostic. Only problem is the cost of diagnosis is the biggest problem. The other important thing is reliable framework and patient care. When I say reliable framework, you go to a doctor, you know that he's really a person who has studied, MBBS, and he is authorized person, a professional licensee. But when you go to other medicinal systems, you don't know. Many people are, even today, acupuncture also, many people are practicing, but we don't know whether they are really studied acupuncture and they are treating. So there are many. See, for example, today, at least for acupressure and acupuncture, there is no legal guidance that who should practice acupuncture, unlike Siddha or Ayurveda. So that's the health record. So this is not applicable for India, but definitely this is applicable for Western countries, where they maintain a health record and they find out. And the most important thing is, whatever medicines you take, these are all the side effects. The side effects are not written somewhere, but typically when you buy certain medicines, the side effects are written, but you can also find out. So it is not disclosed. But when you go for any other medicinal systems, you don't even know what medicine that person is giving. For example, Siddha or Ayurveda, they don't prescribe medicines; they prepare by themselves. But we don't know, what kind of medicine, what it does. We don't know. Actually, it is a myth saying that Siddha or Ayurveda medicines don't have side effects. That we will discuss later sometime. And the most important thing is allopathy is actually good for emergencies. So if you have any emergency or any acute problems, so there are two types of diseases. So tomorrow we have a recording session where I will talk about acute problem and chronic problem. Acute problems are very it comes suddenly and then it causes serious life threatening. So those are called acute problems. So those kind of acute emergencies, the best is allopathy. So you cannot rely on any other medicinal systems. But chronic problems are problems which have developed over a period of time, where it has taken a couple of years, like 3 to 5 years kind of time frame, and maybe there are some symptoms or there are no symptoms. So certain diseases don't come with a symptom very easily. That is why it is recommended that you do a master health checkup every year. So when this kind of problem happens, allopathy is not a best one. So let's understand, what all the. So there are some good things, but there are also certain limitations are there. So first is how it works. That is more important. Nobody gives thought to this. All allopathy medicines work very fast, right? It works very fast. You go to a doctor, you buy something, you take the medicine. Within 2 days, you are back to normal. Whereas the same treatment, through any other medicinal system takes months to couple of months. So the reason is because allopathy bypass your body mechanism, and it doesn't strengthen your body mechanism. So for example, if you have a problem, it bypasses. So this we don't have much time, but I'll give some example. For example, say you have went outside somewhere and you had some food. Okay, so this food is not of good quality, body is not able to digest. So what does the body do? The body tries to throw it out, right? It has only two options to throw it out: one through mouth as a vomiting, or other one is through diarrhea, right? Now, this is what the body does. So when you have the symptom, what you do immediately? You go and get some medicine, and you suppress the symptom. So what you are doing, you are actually intervening with the body mechanism. So what is the body trying to do? It is trying to throw out some toxins from your body by sending it out. But what you are doing, what allopathy is doing, it is actually suppressing the problem. Yeah, that doesn't mean that we can leave it like that. But there are certain things that you need to do. You have to continue your vomiting, or you have to continue your this thing under a medical guidance till the toxins are sent out. After that, you will recover fully. But when you take these suppressants, what do? They make the toxins lie in your body, and tomorrow they create more problem for you. So this is how allopathy works. Especially for certain issues. The second one is, I can give you one more example. For example, cough. When there is a cough, I don't know. Now everybody knows about cough, because after COVID, everybody know that there are certain liquids that are getting stuck in the lung, and the body is trying to throw it out, right? So when you take a cough syrup, which is allopathy, what it does, it actually consolidate that mucus, so that it doesn't interfere with your breathing. So the cough stops. But then what happens? That what do you call that? Phlegm is there in your body, doesn't go out. But on the contrary, when you take certain other cough syrups of Ayurveda, or Siddha, or any other medicine or homeopathy, what do? They try to send it out, through your urine or other things, or they raise your body temperature so that that is evaporated. So here you see the two difference. In the earlier one, it works very fast, whereas in the second one, it takes a lot of time, because it is trying to throw out your entire excess mucus in your body. So this is how allopathy works. So that is why I told, like, if there is a chronic problem, allopathy may not be the right this thing. Second is treatment or management of disease. So when we go to a doctor for a problem, first thing you need to understand is this a treatment he is giving, or he is just trying to manage a disease? So there is an important between these two. For example, there are certain diseases, especially endocrine disease. I think I talked about in the first session, introductory session. There are certain diseases which are caused by glands, right? We have several glands like endocrine glands. So these glands are, many of them are ductless gland. What is ductless gland? Ductless gland means that the blood cannot reach that part. So now what happens when you eat something, stomach digests it, right? And it goes to the small intestine. So stomach actually, breaks down into smaller part. It goes to a small intestine. From there, it is absorbed into blood. So whatever you're eating, it just goes into blood. Okay. And unwanted things are just, thrown out as a stool. So everything has to go into your blood. So the way allopathy or every medicine system works is that, whatever medicines you are eating, they are first getting into the blood. Okay. So once they get into the blood, it goes to the different parts of the body and then it works. So that's how the medicine system works. So when you have a problem related to endocrine glands, for example, you have a thyroid problem, right? Or you have a diabetes, where your beta cells are not working, you have pancreas issue, or you have any problem, then what happens? These medicines cannot go and reach that particular gland, endocrine gland, because there is no way to enter, right? Because there is no blood that is flowing inside. So that is why English medicines don't have any they don't have any mechanism to treat endocrine diseases. So for example, if you have thyroid, so there are two types of thyroid. One is called hypothyroid, another is called hyperthyroid. So when you have a hypothyroid, what it means, your endocrine gland, your thyroid gland is not able to secrete enough this thing hormones. So these hormones go and they work as a signal agent. So what they do, they try to they do a lot of things. We'll not get into this today. Let's take thyroid problem, right? So when your hormones are not secreted, then what happens? You get iodine deficiency. So when you have iodine deficiency, what happens? Then you go to a doctor. So the doctor says that there is no treatment. You have to live on a medicine for several for lifelong. So he gives you a medicine. Now what medicine he gives? He doesn't give a medicine. He gives only a supplement, right? It is just a supplement. So instead of something that is secreted by the thyroid gland, he is giving a supplement. So this is just a management of disease. This is not a treatment. Okay. So treatment means that if you are going for a problem within some certain period, you should be out of any medication and you should go back to your normal life. That is what is called treatment. Management of disease means that you have to keep on continuing with the medicine. Similarly, if you have diabetes, there is no treatment in allopathy. So what do? They give you some insulin or certain other tablets, which is actually doing the work of pancreas, and it is actually making the sugar forcefully go into the cells. So now, if you stop the medicine, what happens? Then the sugar doesn't go, right? So these are not treatment; these are all management of disease. Whereas if you go to other medicinal systems, for example, where see, there are many other medicinal systems are there, like Ayurveda, Siddha, but these medicine systems are still like more like working like they are like 50% of allopathy, how it works, and 50% of energy thing. We'll talk about that later. But but definitely there are other medicinal systems like acupuncture, acupressure. Then you also have certain things like pranic healing, Reiki. They work better there because they can directly go and work with your glands. The glands are connected to chakras. So that's what it is. Second is the third important thing is we have to know whether we are treating our symptoms or diseases, right? So many time what happens, your problems are either related to certain symptoms or there could be underlying disease. So many times what happens, symptoms are not symptoms are only getting treated, not the disease. The important reason is philosophy of medicine. We'll cover that in the next slide. So English medicine unfortunately doesn't have any philosophy of doesn't have any philosophy. It means like for example, you go and ask a doctor how is autoimmune disease happen. He doesn't know because English medicine doesn't say how autoimmune disease happens. Autoimmune disease is basically nothing but your immune mechanism works like against your body. It's like Indira Gandhi was shot dead by her own security guard, right? So that is autoimmune disease, which means like your own security is working against you. Now, why does that happen, right? Why does cancer happen? Why does autoimmune disease happen? There are many problems. Why does somebody get diabetes? So there are no answers to such things. So this is something which is not told openly, but the reality is that allopathy doesn't have any if you ask any doctor, he will not know, because no, there is no, there is still they are doing research, still they are finding out. Okay, but whereas the other medicinal systems have gone advanced and they have already found out why these problems are happening. For example, why does somebody get cancer? So somebody can get a cancer because of two reasons at a very high level. I'm saying. So one is because you are using certain chemicals. Which when I say chemicals, we have to be careful about the word. When we say chemical, everything is chemical. There is nothing called no chemical in this world, right? Everything is chemical. But the word chemical we are talking about man-made chemicals. Okay. So when you are using man-made chemicals for a continuous period, what happens? Your cell DNA gets changed. So they start behaving, they start having a very high growth. So this is one example. There are other things are there. For example, if you know healing, then you know that the huge negative energy that is formed causes cancer. So there are many medicinal systems are trying to give explanation to some of these problems, whereas English medicine doesn't have any this thing. The reason is because there is no philosophy of medicine in this thing. See, what is the term MBBS called? MBBS means Bachelor of Medicine and Bachelor of Surgery, right? And MD means Doctor of Medicine, because allopathy is primarily believing only on medicine and surgery. Okay, whereas other medicinal systems have their own philosophy of how a disease occurs, and they do treatment as per that. Now, the most important thing we need to know is, okay, I'm not telling all these things to discourage you from going for allopathy. Like I told you that allopathy is very important in today's lifestyle. We all need to we cannot shun allopathy, but we also need to know that we should not go to any extreme, right? We should not go to one extreme and completely ignore allopathy, and then end up one day saying that your disease are not getting managed by other body mechanisms, or you should not go to one side and then follow only on allopathy and get into a problem. So you should be having enough knowledge to decide which treatment you should get. That's why I'm talking about all these things. When you see history of medicinal systems, right? How does the allopathy came? Does anybody know why is it called allopathy? Why is English medicine called allopathy? Anybody knows? Anybody want to give a try? Okay, allo means opposite. Okay, so allopathy means you are treating opposite your symptom. That is why it is called allopathy. Whereas there is another medicinal system called homeopathy. Homeo means similar. So we'll discuss this in the next one. So actually, originally, if you see today, US and especially Canada is the place where medicinal systems, I mean, allopathy is very very famous, and especially US is controlling the entire medicinal system. For example, when we had COVID, the protocol for COVID treatment all came from US, right? So they are controlling everything. So now, how did US had this treatment? Did they have any other medicinal system? Just go back to history, then you will understand. So similar to India, US also had many medicinal systems. America was occupied by Western people, from either Europe or UK, and they occupied that country, and almost all the what do you call that native tribes or the Native American Indians were completely today they are not there in a very few senses. Now, these Native American people had their own herbal treatments, okay, and which was very famous. But what had happened is, these herbal treatments were working similar to our Ayurveda or Siddha. So what is happening is that that anybody who has a problem, if he takes this kind of treatment, it used to take a couple of weeks to couple of months to recover. So, for example, I have a problem. If I take a medicine, that in Siddha Ayurveda it takes a lot of time, but the same thing it works very fast in allopathy. So I don't know. I don't remember exactly whether it is World War I or World War II. So during this World War, what had happened is like and they were using this kind of allopathy only for certain very very limited uses. It was not available in the open market. Okay, so so what had happened is, like, during the World War, they had, huge, those days, the World War people were using, were relying only on the people, right? The equipments were, not so important, but the number of army people were more important. Even today, if you see India also, we are counting more on, we are saying that we are third in the world, primarily not because we have equipments, but the people size. So what had happened is, during World War One and World War Two, I don't know which World War. So they had, huge, lack of, army people for fighting, because somebody will fall ill, they will not get up. So when they used to get this treatment, it will take, 1 week to 1 month, and they cannot wait. So then they started experimenting these medicines on these kind of people, and they found that, these people were getting up very fast. So the turnaround was very fast. So this English medicine became very famous because now it was giving quick recovery. Okay, so that's why I told you that English medicine from the beginning, was focusing only on treating acute problems, and it has not been, it doesn't have any philosophy of treating chronic problems. So that's how the history of the allopathy started. And another important thing is availability of treatment protocols. Like I told you, is there a treatment protocol? Allopathy does not have treatment protocol for everything. Okay, so let's understand more about these medicinal system, how they work, and then we will go to the important question of, should we follow allopathy or should we follow any other treatment? So what does allopathy says? Allopathy says, allopathy breaks problems into three types: disease, disorder, and syndromes. So we will not get too much into this. So disease is basically, they say that, this is some, pathophysiological response, which means some bacteria or something has come, either inside or outside, it is creating a problem. So they know that there is a disease because of which it is coming. So they try to, either treat the symptom, or they try to give you a this thing. So that is why it is called a disease. A disorder is, where there is a body structure which is stop working, like, your pancreas is not working. There are certain things that needs to work, it doesn't work. So these are all disorders. So when it comes to disease, allopathy is very good at solving diseases. For example, you have many vaccinations are there, they can treat you with vaccinations. COVID time also, they came up with vaccinations, all these things. But when it comes to disorders, allopathy doesn't know what to do, because they don't know why the certain problems are happening. Okay, it's not that they don't know everything, but there are definitely many diseases for which there is no reason, because there is no philosophy. But now, on the contrary, let's see what the other medicinal systems say. For example, let's talk about Siddha or Ayurveda. Now, why does, if you ask a person, Siddha or Ayurveda practitioner, he will say, because of imbalance in three doshas, you get a problem. So what does that mean? Everybody, has this three, this thing which is called Vada, Pitta, Kapha. So, for example, what is, Pitta? Pitta means, like, your body, generates certain heat. Okay, so when this heat is not there, your body, will start having many problems. That's why you see suddenly when you get cold, right, you get, many problems. Similarly, when excess heat happens also, you get problem, which means that your body needs minimum heat. Now this heat is important for digestion. This heat is important for many other aspects to keep your body, for example, when you have a fever, why do you have a fever? When there are some virus and bacteria, they go inside, what happens, they try to multiply in numbers. Okay, so the virus or bacteria doesn't go and immediately impact you. It takes 1 or 2 days time, depending on the type of bacteria or virus, and in that 1 or 2 days it tries to multiply in numbers. Okay, so that's why, if you have a throat problem, if you do gargling immediately, then, you are out of that problem. But if you don't do it immediately, then you are letting the bacteria or virus to pass through your lungs or body, and then it creates a problem. So, so basically that is the heat. And similarly, your bile is getting secreted, which is important for digestion. That is what is called pitta. So that is called pitta. Then what is kapha? Kapha means, like, see, our entire body, there are a lot of lubricants are there. So for example, we get mucus, right? Now this, everybody thinks like this mucus doesn't, come for a normal person, which is not so. Everybody has liters of mucus in their body. Only when it becomes excess, what happens? It starts coming out. Then you say you have a cold. But when that mucus, is of the required quantity, then it doesn't cause any problem, because it is very much required. For example, when a bacteria tries to enter through our nose, the mucus is trying to catch them. And there are many other things like saliva is there. So what happens when this water component goes less in your body? Then what happens? You get some problem. Then you have kaba. Kaba means like air. See, all our movements need air. For example, we don't have much time to get into that, but we need more of air. So what happens when this air is not sufficient? You start getting joint pains and arthritis doesn't come because of that; it comes because of a disease. But there are many other problems where you get these kind of issues. So basically, what does Siddha Ayurveda says is that your three doshas, if they are not on the similar thing, right? If they are not balanced, you get a problem. Now, yeah, this is why we get many disorders. Okay, while it is very easy to understand why we get disease, why we get disorders is because of this thing. So then what do? They do diagnostic everything based on those three doshas. They try to address your three doshas, right? So that's how Siddha and Ayurveda works. Whereas in acupuncture, acupuncture also works very similar to Siddha and Ayurveda, but I feel like acupuncture is more advanced because the problem with Siddha Ayurveda is that the Siddha and Ayurveda has not gone out of India. Okay, it has not gone out of India, though in pockets people are using it. It has not gone out of India, and whereas acupuncture, Chinese medicine has gone to the entire world. It has gone to the entire world, and it has been recognized by WHO. They've done a lot of experiments, and not only that, for the last 5,000 to 6,000 years, they have been doing a lot of work to improve the medicinal systems. Starting from, you can imagine 6,000 years is like how many years? No, very very long. So they have been treating this thing. On the contrary, if you see Siddha, which originated in Tamil Nadu, it has not even reached to any other state in India. So that's the pathetic state in which our medicinal systems are there. But acupuncture and TCM has really gone very well. So they have done a very good job. So they have made their medicine system multiplied tremendously, and it has been recognized by WHO. Now, what does they say? They have 5 elements, which is called Panchabhuta in our language, right? So it says that it doesn't talk about Vada, Pitta, Kapha. It talks more than that. For example, people who know rugby, people who know okay, I'll not go to that. So, so basically, it talks about many, this thing. So it talks about 5 elements, Panchabhuta. When there is a problem with your Panchabhuta, it creates a disease. It also, talks about various other attributes like climate. What climate happens. For example, during certain climates, you get certain problems. So even that is there in our this thing also. So acupuncture talks about these kind of imbalances. So that's why you see when you have a disease, allopathy works very good because its problem is identified. You go and attack the disease, right? But when there is a disorder, you don't know what to do because the disorder may come because of any reason. What all the reasons? These are all the reasons, like I told you, imbalances, right? For example, why do you get cold suddenly? If your body is not able to generate enough heat, then you get cold, right? Or when you get some bacteria or virus, what happens? They start multiplying in number, and your body tries to fight with them. So what it does, it creates a lot of mucus and it tries to send them out. So that is how body works, right? So in the first cause, it is actually a disorder, whereas the second one is actually a disease, right? It's not a disorder. I'm just giving us an example for you to understand. In the first one, there is no understanding of, in allopathy, there is no explanation saying why suddenly somebody got a cold. Whereas here, there is an explanation why somebody got a cold, right? That's the difference between the philosophy of allopathy and other diseases. There are other medicine systems are there. For example, homeopathy. Now, see, we can break medicinal systems into two buckets. Okay, one which works against our body or which bypasses our body. I think we should not say the word against. It is bypassing our body and working. And there is only one medicinal system in the world which works this way. It is allopathy. It directly intervenes with our body function. It does the work. For example, when you have a fever, you are given antibiotic. So when you take antibiotic, what happens? Your immune mechanism doesn't work. Okay, and rather, the antibiotics work. When you keep on doing this, what happens? Your immune systems are not trained. For example, uh, last year, when we had a problem between India and China, I'm just giving some of these examples for you to understand better. When we had problems with China and India, so there are some people who are saying China had a huge army. They are the number two in the world. I think number three, I believe, after US. I think UK, something like that. and they said India is in some fifth position or something. India will not be able to win the war. Whereas some people are saying like, no, 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 Chinese people, don't have enough practical experience. But whereas Indian, army always had conflict, with the East, and also with Kashmir, everywhere they have been fighting. And that also proven to be true during, Galwan issue, where you see Indians had a huge victory, whereas Chinese, they pathetically lost it and they tried to cover it. The reason is because that, only when you start doing something right, you gain the skill, right? Similarly, you have immune mechanism in your body, but this immune mechanism, learns through machine learning. Like today we have machine learning in our IT, similar to that. It learns through some learning process, right? Not through machine learning, through some learning process. So how does it learn? When it sees some bacteria or virus, it tries to tries to stop it. So when you get more and more problems, see, for example, I'll just give you another example. There are people who are staying in US for 5 to 6 years. When they come back to India, even if they take some small quantity of water, which is not a mineral water, they get problem because their immune system doesn't even work. Whereas in India, you are exposed to so much of dust, allergy, poor quality of water, so many things. Your immune system is continuously fighting with it. So this is the problem, where allopathy works by bypassing your body functions. Now, all other medicinal systems in the world, they don't bypass any body mechanisms. They try to only enhance. So that is another reason why allopathy works faster, whereas other medicine systems work slower. And also, there are certain medicinal systems may not work at all. People may not tell you. For example, if you have sugar, and if it is 200 plus or something, homeopathy doesn't work. So it doesn't work. You cannot get any treatment from homeopathy. Similarly, diabetes, unless you treat it at a very early stage, you don't get something. So there are some limitations. Now you can also classify medicinal systems into another bucket. Whether it works at a energy level or it works at a chemical level. So what is chemical level? See, you take some medicines, right? Now, for example, you have a headache, you take paracetamol, right? Or somebody has a acidity problem, so they get headache. They take some pantacid. So they take many medicines are there. Now, how do these medicines work? They are chemicals. Like I told you, they have to reach the blood and then they have to go to the different parts and they have to work. So that is how it works. Whereas if you see other medicinal system, they're also giving you same medicines only, right? But only thing is these are all man-made chemicals. These are all chemicals available in the this thing. So that is why these chemicals, are actually less having less side effect. But that doesn't mean that these chemicals won't create a problem. This is something myth that we have to understand. These chemicals also can cause a problem if you take overdose. For example, certain Ayurveda or Siddha medicines, if you taken in overdose, can cause death also. So that doesn't mean you can go and buy anything on your own. So you have to understand this thing. But see, look at either allopathy or Ayurveda or Siddha. All three are working at the same level that they are using only chemicals to solve your problem, right? So that is what is called working at a chemical level. Now, there are other medicinal systems which are working at a energy level. What is energy level? For example, in acupuncture and acupressure, there is no treatment given using any medicines. It is a medicine-free treatment. I talked about this in the first class itself. So now, how does it work? It works at an energy level, right? So I explained this in the very beginning itself, right? I will just repeat it if there are any people who didn't attend my first class. So our body has, our body has certain self-healing property. It's a very high-level theory. If you go into too deep, we can talk about this for 3 4 days actually. At a very high level, I'm saying that our body has a self-healing property. So the self-healing property, what it does, any problem it tries to solve. For example, you have a cut in your hand, it gets cured. You have a fever, even if you don't take medicine, in 2 days or 3 days. See, there is a saying, if you have cold, if you don't take a medicine, it will take 7 days to get cured. If you take a medicine, within 1 week you will get cured. Right? This is what people say. I don't know whether you heard about this. So that's the thing, right? So whether you do it, whether you take the medicine or not, your body is also trying to cure it. But if you take any medicine, what happens? The rate of healing is faster. Now, instead of relying on medicine, what if we can increase the rate of healing? That is what the idea is. Suppose you have a chemical reaction. So all of you might have know what is a chemical reaction. So there is a catalyst. So what does a catalyst do? It is trying to increase your chemical reaction much faster. So similarly, what happens? This energy is the main use. So the energy is the main fuel that is required for your body, for your function of your body. Not only for functioning of your body, it is also required for your self defense mechanism and for healing, right? For example, people who are very aged, they don't heal faster. They take a lot of time. But whereas the young people, they just recover very fast. The reason is because the store of energy they have in their body is very high during early days. At a old stage, death is nothing but absence of energy. So at a very later age, what happens? This energy level comes down, because of which you don't get healed faster. So what these medicine systems like acupressure, acupuncture, or Reiki, pranic healing, or homeopathy, they try to do is they increase your energy level, okay, so that your body can start fighting with it. Many people think homeopathy is actually a you are taking some medicine. Homeopathy, you don't take any medicine. Okay, I don't know. Does anybody know how homeopathy medicines are prepared? Any idea? Okay, so yeah,
No, sir, we don't have. They give some. That's
they
all.
use sugar balls. Okay, yeah. So basically, what they do, homeopathy works on a like we talked about philosophy of medicine, right? So homeopathy works on a medicine philosophy called similia similibus. What is similia similibus means that uh, there is a saying in Tamil, which I don't know what is the saying in English. Somebody can help me. Mulla mulla ladan edukanu. So what is it called? You take a thorn out of another thorn, right? So that's what it means. So that is basically nothing but the treatment modality of homeopathy. So what do they do? That if you have a problem, suppose you go to a doctor and say you have a fever. So you go to English doctor, what does he do? He gives you paracetamol and he gives you, some antibiotics so that your fever can come down and then you become recover. But when you go to homeopathy, what the person does is he gives you some medicine to increase your fever. Okay, so I don't know how many of you know this. Okay, but that's what really happens. You go to a doctor and you say you have a fever. He gives you some medicine to increase your fever. So what he does, he finds out what all the symptoms you have, and he gets he identifies the medicine that you should take, which has a similar symptom. For example, cinnamon, right? All of you know what is cinnamon, right? We use it in very small quantity, but when you consume in large quantity, you will get fever, very high fever. So basically, what the cinnamon does, cinnamon has some chemical activities. So similarly, there are many other things out there. So what these people do, what these medical practitioners do, they find your what you call your symptoms, and they give you some medicine which actually increases your problem, right? So what happens? It's So basically, it is like for example, let's say you have some 30 days to study for an exam. Till 20 day we don't study, right? We keep doing some or other thing. Just in the last 10 days, no, we suddenly start taking books and start doing, and the last day, no, we start doing something. That's what we do, right? So similarly, what this body does, it doesn't act on any problem. Okay, there is a fever, no, it doesn't act, no, it acts very less. But then what happens when you take these homeopathy medicines? Yeah, correct. When you take this homeopathy medicine, what happens? It increases your fever. So then the body suddenly wakes up and says, "Oh, there is a problem. I have to act on it fast," and then it acts on it. So here, what do they do? The homeopathy don't give any medicine. Okay, they give you either they give you a placebo. So they know that there are some problems which are psychological in nature. So if they know that this is simply psychological nature, they can give you a placebo also. You know what is placebo, right? They'll give you a sugar ball and they eat it without knowing that. So they give you that. Or what do they give? They give you a proper medicine. Now this, how do they prepare this medicine? What they do is, like I told you, they have several symptoms. So they identify for this symptom, this is the medicine. Now they take that medicine and then they dilute it so that it becomes parts per billion kind of thing. So they are calling, they have some dilutions like 3x, 10x, 20x kind of thing. So they dilute it and they make it very less. So what happens when it becomes very less? It doesn't have any chemical in it. It has only the energy of that chemical. So when you consume it, that energy goes and it increases your, it works at an energy level. So, so that is how that systems like allopathy doesn't work at energy level; they work only at a chemical level. Whereas these medicinal systems like Reiki, pranic healing, or Reiki, pranic healing, or what you call uh, homeopathy, they works at an energy level. So they don't have any chemicals in it, right? They are working only at an energy level. Now, Siddha and Ayurveda are little different, okay? Or not only Siddha Ayurveda, any herbal medicines work both at a chemical level as well as at an energy level. Now, when does it work at an energy level? Only when it is properly manufactured. Okay, when I say manufacture, I'm not talking about industrial manufacturization. I'm talking about the person goes and buy plucks that herbal from directly from that place, and he prepares it and then he gives you. Then only it works at an energy level. Otherwise, it doesn't work at energy level. It works only at a chemical level. That is one reason why today, if you have a problem, you go to a Siddha or Ayurveda doctor, you don't get a faster this thing. So this is one reason. This is not the only reason. This is one reason because he doesn't give you, he doesn't give you immediately, right? For example, if you go to homeopathy, he will prepare the medicine and give it to you. If some homeopathy doctor is giving you a prescribed homeopathy medicine, then he is not a good homeopathy doctor. So he has to give you medicine by preparing it by himself. Okay, or he will ask you to go to a homeopathy shop. There you will have to wait there, and they will prepare and give it to you because it will be prepared. Then it has an energy level. So that's how it works. So similarly, Ayurveda Siddha also has energy, but today because it became industrialized and they have started manufacturing as a tablet and other thing, they don't have no energy effect, but still they have the chemical effect. So now you understand, right? So what I want to make all of you understand is that uh, that all medicinal systems are not same, and there is nothing called superior medicine systems or inferior medicine systems, right? So allopathy is very very advanced. We should not shun it. Just saying that that it has a side effect. It is very useful because in today's lifestyle we get many problems if you don't do proper master health checkups. If you don't do proper treatment, if you have a problem, you don't visit a doctor, then you don't know what the problem is, right? So whereas there are diagnostic techniques are available, but still in Ayurveda, Siddha, homeopathy and all, but as I told you, they are not as efficient as a proper diagnostic, right? So allopathy should not be shunned. You should not shun allopathy. So you should go to a doctor if there is a problem. You have to do a proper analysis, treatment. You have to do that. But the most important point is you have to also have a knowledge of what is that medicine. Are you taking a treatment or you're getting a management of the disease, right? If you are getting management of the disease, then maybe you have to look for something else also, right? Maybe this is not good. Or if you are getting treatment only for your disease, then you should understand that that there are other medicinal systems which are available. And if you want a permanent solution, I have been, I think I had given this example in many forums. I'll again give. Suppose there is a tank, okay, which is having water, and every day in the tank you have to fill water because there is a leakage. So, what is the best way to solve this problem? See, we have two ways to solve the problem, right? One is to fix the what is it? You have to fix the leakage, right? That is a permanent solution. What is the other solution? You keep adding water, right? So if you are treating symptoms, then you are actually doing the second thing, the later one, where you are not addressing the problem. But if you are treating the root cause, right? See, because a problem can come because of many reasons. See, today there is something called holistic therapy that is very famous. Recently, also I visited. So holistic treatment is very important. Why is because many of your problem doesn't come because of these factors called pathological problems. They come because of many reasons. Like I told you, cancer. Majority of the people are getting cancer primarily because of two reasons. One is that they are exposed to chemicals, overexposed to chemicals. Chemicals mean don't think like you are going working in a chemical factory. I was working in a refinery for 5 years in my early days. There are dangerous chemicals are there, and those dangerous chemicals are there at our home also. For example, if you are using perfume, if you are using this thing, all these underarms and other things, they are all nothing but chemicals. So what is the you see? Just see how they are prepared. They are all prepared from they are all byproducts of crude and further byproducts. So they are all chemicals, right? So that is one. Other one is, example like I told you is feeling. So today diabetes, many people are getting diabetes. So diabetes is coming not because of food habits. It is coming because of lifestyle issues. Because many of us are working in IT industry and many other industry where we are exposed to a lot of stress. It comes because of that. When you have huge stress, your pancreas goes for a toss. Your pancreas doesn't work. Then what is the point in you trying all problems, sort of mechanism to trying to revive your pancreas? Even if you revive your pancreas, again you are under stress, again it will go off. So first problem is, see, we have to understand. So in Tamil, I think there is a very important this thing. Thiruvalur said, "Noi nadi, noi mudal nadi, noi adu kanikkum vai nadi vai pachiyal." What it means? Noi nadi means noi means disease. So first you have to understand the disease. That's what the doctor does. Okay. So he first try to understand your disease. That is what is called in English called diagnosis. Noi nadi. Noi mudal nadi. Noi mudal means first. Noi mudal means no. You have to find the root cause. This is not done anywhere today. Unfortunately, nobody does this. So you have to find out the root cause of this thing. See, gone are the days where you had no family physician and all, right? Today there are no family physician. So family physician will have all your history, so you will understand the problem. So that is called root cause. So you have to find the root cause. Noi nadi, noi mudal nadi, adhikanikum vai nadi, which means like to solve that problem, what you need to do. So basically, you should not only address the problem, you should also address the root cause. Only when you address the root cause, then only your problems will get resolved. So this is what I want to tell you, that don't shun any medicine systems saying that this is good or this is bad. Allopathy is very, very important, but at the same time, allopathy has certain restrictions. It has highly good advanced diagnostics. It can solve acute problems. Emergency, it comes very hand. It does a lot of things. You can foresee your problems, and you can identify even before it comes if you do proper masteral checkup. And it is very helpful during certain problems and all. But it also has limitations. On the other contrary, other medicinal systems also has limitations, but they are good at it. So it is your intelligence level to understand about these systems and take proper treatment, right? If you go for one medicinal system, then you are actually not doing the correct thing. I think with this, we'll stop here. So that's what the answer to this. Which medicinal system to use? There is no one answer. It depends on your problem. And the most important thing, as I told you, that if you have a problem, don't stop at this level, that you go to a doctor. It could be any doctor. It could be Siddha, Ayurveda, it could be any doctor. Don't just go to a doctor and try to find out what the problem is and he gives you some medicine, you live with it, right? First, you do some analysis, right? See, we show a lot of interest, no? For example, at least in this group, 80% of people, I believe you would be having enough knowledge on finance, right? Even if you're not a finance person, you have enough knowledge on finance, because we know that without finance, we cannot survive. Right? Personal finance, many of you must be knowing, no? You know where to invest, what to do, all these things. But unfortunately, health, we don't take it so seriously, because we assume that, that I go to a doctor, that person will take care. It is not so. It is your health and you have to take care of it. So you need to have some idea about, what problem you got, why the problem is happening. And you also need to, so for example, I have diabetes. Now, if I go back to my history, then I know why I got diabetes, right? But if I tell the same thing to a doctor, he just talked to me for 5 minutes. So how he will know why I got diabetes? He will not know, right? So you need to understand. So it is our health. So we have to invest time and we have to learn more about the diseases and disorders, and that's what we are going to do in this thing. So now one quick thing I'll tell you. We have only 5 more minutes. So in this course, I'm trying to see. This is more like a diploma on acupuncture. But what I'm going to give you is that I'm going to give you a lot of tools. This is the second session we have. First session, there are already some people who are attending for the second time. They can also talk about it. But I'm going to give you some tools and all so that you can practice. But still, what is important is don't go to this level that this problem I'll just use this. Then you can as well use a book. You can buy a book and then you can start doing it. First of all, whether people are doing it after the session, that is an important thing. But even if you practice also, you have to go beyond certain things, right? See, we can all learn so many things. There is no problem. You can learn. Everybody can learn at least some 3 different things. When you learn different things, your brain becomes more powerful. So definitely, what you should do is in this course, whatever I'm giving. See, this is not a fully organized course, which means like I'm not giving you any course material or anything, but I'm going to give you a lot of tools. I'm going to give you a lot of places where you can go and find things, but you have to invest some time and you have to learn on your own. Okay, and when you learn on your own, then what happens? You understand why problem happens, why disease happens. See, I'll tell you some 12 years back, at my home, we all, I think not at my home alone, everybody, if you open anybody's fridge, okay, so you have only two things there. If you are a South Indian, you have the dosa batter, and then you have medicines, right? These are the only two things that are there. But we came to a level where today we have no medicines at our home. And I'm not a no, I'm not a doctor. Or I'm not anybody because I invested so much of time to understand why problems happens. Right? This is very important. No doctor in this world will address your problem by understanding your root cause because they don't have time. I just talk about only one thing, and then we'll stop here. See, today so I'm talking about all these things to give you more emphasis, no? Because see, when you have a health problem, especially if you are 50 plus, you have a health problem, you are into big soup. One is because as long as you are working, you have a health insurance. The moment your work is not there, right, you don't have a health insurance. They charge you very high. You go to any doctor, 1,000 rupees, 2,000 rupees, and if you are 80 plus, you don't get any health insurance. So health is the biggest problem today, right? Gone are the days where you say I will go to a doctor, no, I will take care of things. So things have become very complex. So it is important for you to understand. So one simple thing I'll tell you, like today to become a doctor, one person has to spend at least 1 crore, correct? So how does he get this money back? I'm not going to answer, you know the answer. Right? So so if you think like if you have a health problem, you go to a doctor, he takes care of it. It is not like that. Okay, so for example, all of you are doing filing of your income taxes, so you go to the auditor and auditor takes care of everything. So health is not like that. Okay, so you have to worry about your health. So I think we'll stop here.
Sir, I have a question.
Yeah.
Um, there is a viewpoint that all diseases are psychosomatic, right? At some level, it's emotional. So what's your take on that?
It is true and false, madam, because see, that's what I told you, right? American, when come to India, he drinks a water, he gets a problem. Correct. Now, why he gets a problem? Why we not? Because our threshold level is at that level, right? So similarly, your body can handle many problems. Okay.
Okay.
Now that level of you know that that immunity level will be high only when your mental state is very good. You don't have stress. You don't have, so that's the answer to your question. I hope you got the answer, right?
Yeah, actually, I read a couple of books like Heal Your Body and one more book from Edward Back. So both books talk about similar viewpoints where even for each disease, for example, like if it's cancer, so she's given it as long held resentment, so which manifests into cancer. So for each disease, she's given a table and what is the positive mindset we need to have, like a set of affirmations. So I was just thinking
No, no, that's what, madam. That yeah, it's true and false. What you said is true and false, because many diseases come because of external factors, right? So we can't say it is because of some mental state or something. But it's not that everybody get the. See, look at COVID. Not everybody got COVID, right?
yeah.
So the reason is because some people are having good immunity because they were never used any medicines, or some people, they always at a very good mental state. For example, the moment you are under fear, your immunity goes down.
Uh,
So, so it's true and false. It's a very complex relation. It's not so simple. And whatever you read in the books, I believe that is correct. I have not read those books, but I believe that is correct because if you know healing, then you understand that there are various energy levels in our body, and these energy levels, they try to control your body. Uh, like there are different chakras are there. So these chakras have to work properly to keep your body up and running. But when you are under stress or when you are under different things, it could be, see, any emotions, whether it should not be very high or very low. For example, even if you have a very See, for example, we think happiness, it's good, right? Too much of joy also is bad. That creates a problem. So when you are in a balanced mental state, your immunity works at a optimal level, so that you are always insulated from any other environment.
So it's kind of like maintaining that equanimity in the mind, like equipoise state.
Correct. That's why this holistic meditations are working well, because they not only see, one is that they are trying to address the root cause. Like I told you that if stress is the problem for your is the reason for your problem, right? What is the point in taking medication for it? Correct. It solves the problem, but again it recurs back. So holistic medication is all about addressing everything, right? You're addressing your mind, addressing your body, everything, right?
Okay.
Yeah, that's what my view is, madam.
Okay. Thank you.
Okay. Any other questions? Okay. So with this, we'll stop here. So tomorrow's session, we will not have online session. So I will place a recording. Sorry, does anybody have a question? Okay. So for tomorrow's, this thing, there won't be any session, but I will place a recording. You can access it by end of day, and you can read it, before the next class. So there I will talk about disease and disorders. What is disease? What is disorder? Whatever we discussed today, we will go more into detail, so that you can understand. This will help you to understand more about the problem. So first two classes are not related to acupressure. This is just at a very high level. But only from the third class, we will start talking about acupressure. Okay. And one more thing, please, if you are not signed up for the group, please sign up for the group, because I saw still many people are not seeing the message. So today I sent individual message to everybody, but from next week, I will not send any individual message. I'll be posting only in the group. So please go to the WhatsApp group and sign up there. If you are not part of the WhatsApp group, so there are two WhatsApp group. One is for learners, another is for meditation. You can join either one of them, and also sign up for the Google Classroom, because I will be posting all materials only through the Google Classroom. Okay. Okay. Thanks everyone. Good night, and see you again next week.
Thank you. Thank you so much, sir.
Thank you. Good night.
Thank you. Good night.
Thank you, sir. Thank you so much.
Thank you so much.
Thank you.
Thank you so much.
Thank you.